Hello, this is the oral cavity anatomy presented by the SchrDbb with reference Pocket Atlas of Human Anatomy by Heinz Feneis and Wolfgang Dauber. Okay, so here we're going to visualize the oral cavity anatomy. So for the oral cavity anatomy, the first point I'm going to show, these are the diagrams involving each of them. So we have the different various parts that we have in the oral cavity. But now I'll first start by a brief introduction to the oral cavity. So the oral cavity is made up of the lips from external to internal. Externally we have the lips, and we have a brief anatomy of the external part of the oral cavity, and then we have internally what is found inside. We have the teeth, the tooth, we have the tongue, and then we have the various anatomy of each of these parts. We also have the palate, which is found superiorly. We have the base of the floor of the mouth, which is found inferiorly. We have the lateral side, which is the buccal cavity, and then we have the gum. So all that is found inside the oral cavity. In addition to that, posteriorly in the oral cavity, here we are going to have the pharynx, and then inferiorly we have the larynx, though the larynx is not much more considered inside the oral cavity, but it is instead more inside the respiratory system. So we start by visualizing. After having a brief anatomy of the individual parts, we will now start by visualizing each of them individually. So we start with the first part. Externally we have first the lips. Now the lips is divided into two. We have the superior lip, we have the inferior lip. Now inside the superior lip, we have what is called number 8 here, is a tuberculum. Now there is a separation which is at the level of the superior labia with the superior lip. This separation is called the filtrum. The next part is the angle of, at the level of the angle of the lips here, is going to be called either the angle of the lips or the commissure of the lip. The next part is this number 13. And number 13 here is the buccal fat part. And then the next one here, number 12, is the cheek. The cheek can also be considered the jaw. It's easy as that. Now, after visualizing the first part, we are going to enter now inside the internal part of the oral cavity. Now in the internal part of the oral cavity, we have what the first part here, which is number 20, which is the frenulum. This part here is the frenulum. The frenulum is what attaches the internal part of the lip to the gum above. And we also have another frenulum here. So this is the frenulum of the superior lip, and this is the frenulum of the inferior lip. Now number 22 are the gums. So this 22 here is the gum here. Now we have already seen 6. 6 was already considered as the superior lip, and 9 was considered as the inferior lip. So now the next thing to visualize is number 37. So number 37 is only the lingual gland. The sublingual gland is the anterior part of the sublingual gland is number 37 here. Now you have other rudimentary glands. These are minor glands inside the oral cavity. They can be the buccal gland, the labial glands. So the labial glands, these ones are the labial glands are going to be closest to the lips. This one here, the lingual gland, they are essentially lingual glands. Here we are going to have the buccal glands, which are close to the jaw. We have the palatine gland, which is close to the palate. So now the next thing to visualize is number 26. So number 26 is the sublingual papilla. Now after having visualized all what is inside, we now visualize now the teeth. So here is in anteriorly you have the incisors, then you have the two canine, then you have the premolars, and you have the molar. The last molar is called the wisdom tooth. So now the next thing to visualize, so you've seen also this, you already know that is a commission. The next thing to visualize is this is the sagittal section of the head. So see how the superior and the inferior labia, you have this part inside here, which is number 3, is the vestibule, and the vestibule is the space between the labia or the cheek and the gum. So the space between the labia and the gum is said to be the vestibule, or the space between the cheek and the gum is said to be the vestibules, just like here is the vestibules. Now the next thing to visualize is going to be the palate. So here you are going to have the hard palate here, and then the one which protrudes posteriorly is the soft palate, and at the end of the soft palate you have the uvula. So here is the oral cavity proper. Now the next one to visualize is this here. Here you have the hard palate, number 16 here is the hard palate. Now the 30 here is the incisive papilla. Here you are going to have the tooth. So at this end of the tooth here, which is number 24, it is the gingival papilla. The papilla are the one which are outward projecting, while the other one, if it's not a papilla, is going to be a margin. The margin is going to be inward projecting. So 24 is the gingival papilla, while 23 is inside the gingival margin. So after that we have this here are the palatine glands. As I've told you, they are minor glands, but they are situated close to the palate. Now the next one is number 17, and number 17 here is going to be called the soft palate, as you have already seen here posteriorly. So this is the first diagram. So the next thing we're going to visualize are the other diagrams involving the oral cavity. So these are the next diagrams involving the oral cavity. So now the next thing to visualize is going to be the incisors. Okay, to visualize the incisors, so here we need to know that these are going to be the teeth. So you're going to visualize now each part of the anatomy of the oral cavity. So at the first place here we have the teeth. Now the teeth is going to have different parts. So this number 32 here is going to be called the incisor margin. You've already seen the margin. There was above here was the gingival margin. This place here, this place which is protruding upward, the gingival margin, while the 23 which is protruding inferiorly is the gingival. This one is a gingival papillae, sorry, 24 is the gingival papillae, while the one that protrudes inward is the gingival margin. So we now continue with the next diagram. So you need to know that what, so this number 32 here, is the gingival margin. Now these are this here we are going to be visualizing the teeth from inside. So just make sure that you try to visualize the teeth from inside the mouth. So when you visualize the teeth from inside the mouth, here you have the incisor margin. Here you're going to have this 30 is the cingulum. Number 26 is the lingual and the palatine surface. The lingual and the palatine surface of the tooth. Number 31 here is the marginal crest. So these are the incisors and the canine tooth. Now the next thing to visualize are the premolars and the molars. So these are the molars. The 24 here is going to be called the vestibular surface. So vestibular surface is the part that is going to be closest to the vestibule. So now I've already said initially that the vestibule is the space which is in between either the lips and the gum or the cheeks and the gum. So this is the vestibular surface, 24. Then 17 is the transverse ridge of the molar. The next one is 18. 18 is called the dental tubercle. Now the next thing to visualize on the tooth, you need to know that what the tooth is going to be divided mainly into two. You have the crown and you have the root. This 19 here is the crown, with the one which is visible to the eyes, and the root is the one which is implanted or is deep seated inside the gum. Now the next thing, so after visualizing it, also this is the crown, the root of the incisors, and this is the crown and the root of the molar. So the first, you need to know that what the first two molars have three roots. The first two molars have two roots, while the third molar have three roots. This is for the superior, for the superior molars. The first two superior molars have two roots, while the next, that's the third superior molar, has three roots. Why in the inferior molars, the first molar only have two roots, while the next two molars have three roots. Now the next thing to visualize is you need to visualize this is the crown, the 13, and this is the root. Here is the neck, number 20 here. So number 14 is going to be called the cups of the root. So these ridges here are the cups of the crown, sorry. And then here number 24 is going to be called the vestibular surface of the crown. So now after visualizing all of this, you need to have in mind another characteristics, other structures inside the tooth, inside the oral cavity. Now for the other structures inside the oral cavity, we have this number 2 here is the sublingual gland, while number 5 here is the submandibular gland. Sublingual gland is called as such just because it is located inferior to the lingua. The lingua is actually the tongue. So when it is because it's located just inferior to the tongue, it's going to be called the sublingual gland. And these are the ducts which connect the sublingual gland into the oral cavity. Number 3 here is the major duct, is a major sublingual duct, while number 4 here is going to be the minor sublingual ducts, or these accessory ducts here. It's the same for the submandibular gland. For the submandibular gland, there's one main submandibular gland that's going to be connected into the oral cavity, which is the major submandibular duct, which is number 6 here. Now it also goes for the parotid gland. Now the parotid gland is divided into different parts. Now is it clear? So we have the major parotid gland, which is divided into a superficial and a deep part, and we have an accessory parotid gland here. Now there is a duct, major duct, which connects the parotid gland at the level of the superior second molar. So it's connecting to the level of the superior second molar, and this is the duct of Stenson's, or the major parotid duct. And then this other now is the minor parotid duct. Now this, as you already seen here, was the submandibular gland. Now as you can see already, again, you already know that this is the papilla, the gingival papilla, and this is the margin, as you have already seen. Now the next thing, we have already seen that this was the scopes. So 28 here is the mesial surface. So we have seen that this was the cups of the teeth and all that. So we now visualize the neck structure. So this is now, we are now going to visualize the anatomy of the tooth in a deeper aspect. So this is the tooth seen from a cross-sectional view. So you are going to visualize that what here, number 1 here is the pulp cavity. So all here is the pulp cavity. Now the pulp cavity consists of the pulp chamber of the crown, and it also consists of the pulp chamber of the root. So Now, after having the pulp cavity, the next part, which is directly connected to the pulp cavity, is the dentine. So the dentine is the made up of connective tissue, dense connective tissue that is going to be directly connected to the pulp cavity. And the pulp cavity, at the root of the pulp cavity, we have an outlet here. Number 4 is the apical foramen of the root. So here you have some blood vessels that are going to be entering inside the pulp cavity, and then also you have nerves for innervating and for blood supply. So the next one is the dentine, which is located just lateral to the pulp cavity. And now we need to know that what again much more lateral, we have this part here. So this part here, above here at this level, you have the neck of the tooth. Here above you have the crown of the tooth, and then here below you have the root of the tooth. Now you need to know that this number 12 here is going to be called the periodontium. This is the periodontium, and the periodontium is what connects the tooth to the gum. Generally, that's the definition of that. It connects the tooth to the gum. Now since it connects the tooth to the gum, you need to know that what the periodontium is connected to is divided into different parts. You have the part which is protecting above here, which is number 13, is called the periodontium protectoris, the protector periodontium. And then the part which is connecting with the root of the tooth is going to be called the periodontium insertionis. Now the periodontium insertionis consists of different parts. It consists of the periodontal ligament. As you can see, 15 here is a periodontal ligament. It consists of the cementum. The cementum is number 16, as you can see here. And then it also consists of the alveolar process. The alveolar process is number 17. So all that make up the periodontium insertionis. So that is for the internal anatomy of the tooth. The next thing, as you can see here, this is the histologic view of the tooth. In the histologic view of the tooth, you have the dental papilla. Inside when you see the histologically, you have many dental papilla with the odontoblasts. So those are cells inside the tooth and all that. Now the next thing that we're going to visualize now is going to be the other part of the oral cavity. So here number 20, as you can see are the incisor tooth. Here is going to be canine. Here you have now the tongue. The next thing to visualize now is the tongue. Now the 37 here is the tip of the tongue. So as you can see here is the apex or the tip of the tongue. Number 35 is going to be called the fimbriated fold of the tongue. Number 34 is called the inferior surface of the tongue. Here number 31 is going to be called the superior surface of the tongue. Here is the posterior part of the tongue. Here is the apex of the tongue. Here is the inferior surface of the tongue. Now number 34, as you have already seen, is the inferior surface of the tongue. Number 29 is all this is the tongue. Now you have already visualized the tooth and all that, so you're not going to come back again on that. So here is just a small histology of the enamel. So number 9 is going to be called the dentine, while number 10 is the enamel. As you can see, the dentine is less concentrated with connective tissue as the enamel. This is why the enamel is considered as the strongest part of the body, and directly after it you have the bone. So you are not surprised by the fact that you are capable of crushing bones with your teeth. You are capable of crushing bones with your teeth because your teeth is stronger than the bone. As easy as that. So now we continue with the next part of the anatomy. So here we continue with the anatomy of the tongue. So this is now the histologic aspect of the tongue. It's much more of a histologic aspect of the tongue. So you need to know that the tongue is made up of multiple papillae. So number 4 here are the filiform papillae. So here it's filiform. Why? Because they have hair-like heads. Their head is just like hairs. We have number 5 is a conical papillae, just because it is like a cone. Number 6 is a fungiform papillae, just because it's like it has a dumbbell, just like a mushroom. Number 7, we have a circumvallate papillae. As you can see, it is it's a circumscription, so circumvallate papillae. Number 15 here is going to be lingual follicles. We are going to visualize that later. Now, you need to know that this is the inner anatomy, the microscopic anatomy of the tongue, and this is the gross anatomy of the tongue. So on the gross anatomy of the tongue, what do you visualize? You can see, you need to know that on your tongue you visualize some papillae, but you cannot easily distinguish them. You need to know that the papillae which are located medially and anteriorly are going to be usually the fungiform papillae. They are the ones that can be seen. Laterally, we are going to see other papillae, and these papillae are called the foliate papillae. So in all, there are 5 papillae. We have the filiform papillae that we have seen already here. We have the conical papillae, we have the fungiform papillae, we have the circumvallate papillae, and we have the foliate papillae here. So now here at this, the number 10 is a median groove of the tongue. So this here, the line here, is the median groove of the tongue. Usually at the posterior part, you have the circumvallate papillae here. Now, posterior most the tongue, at the posterior most part of the tongue, you have a sulcus, and this sulcus is called the sulcus terminalis. And then at midpoint between the sulcus terminalis, you have a foramen here, and this is called the foramen secum. And the foramen secum is from where that the thyroid embryologically develop, and then it goes downward through the thyroglossal duct. It goes downward through the thyroglossal duct and ends inside the neck. Now here you have what is called the lingual tonsils. Number 14 here is the lingual tonsils, just posterior, and here we have the epiglottis. Now this is also another histological anatomy of the tongue, and this histological anatomy helps you to visualize the intrinsic muscles of the tongue. So number 23 here, the muscle here is going to be called the superior longitudinal muscle. You need to know that there are mainly 3 types of muscles inside the intrinsic muscle inside the tongue. We have the vertical muscles, we have the horizontal muscles, and we have the oblique muscles. Or you can also call it the longitudinal muscles. In this case, number 23 is the superior longitudinal muscle. We have number 24, which is the inferior longitudinal muscle. We have number 25, which is the transverse muscle, and number 26, which is the vertical muscles. So we have vertical, longitudinal, or transverse, or you can still call it the horizontal, the vertical, and then the oblique. Now, the next thing to visualize, after visualizing, we have number 16 here, which is a lingual septum. So lingual septum, if you cut it, you visualize from inside the septum that is separating at this level here. At this level where there is a median groove from the tongue, there is a lingual septum which is separating. And then number 19 is going to be called the genioglossus muscle. So now that's now bring us to the external anatomy of the tongue. So in the external anatomy of the tongue, we have certain muscles of the tongue which are involved here. So on these muscles, before we go to the muscle, we just have a brief visualization of this papillae. So just have a name in their head. So what's the name of this papillae? Is called the foliate papillae. Then the next one is this papillae here, which was much more located posteriorly, where the circumvallate, and then here are the tonsils, the lingual tonsils. Now you're going to visualize the external muscles of the tongue. So to visualize the external muscle of the tongue, it's good to have the generally the processes which are the bony processes which are located in the geometric array of the tongue. So anteriorly, you need to know that here there is the mandible, the mandible, and the mandible just posterior on the midline. You have a process called here the genial tubercle. So the genial tubercle is going to be connected to the tongue to form a muscle called the genioglossus. That's why the number 19 muscle here is called genioglossus muscle. Now, inferiorly here, you have the hyoid bone. So the hyoid bone is also going to have a process. You're going to have a musculature attaching to the tongue. So you can already guess a name from that. You have a muscle called the hyoglossus. That's why number 20 here is called hyoglossus muscle. Now you need to know that the hyoid bone also have a part which is having cartilage on it. So there's a small part of the hyoid bone, not a major part, but a small part of the hyoid bone that has a cartilage on it. And then the cartilage scientifically is called chondrum. So that's why the connection between that cartilage and the tongue is going to be called the chondroglossus muscle. Now posteriorly here, we have another process, and this process is going to be called the styloid process. So the styloid process is also going to produce a muscle with the tongue also called the glossus. So it's going to produce that tongue, and that muscle is going to be called the styloglossus muscles. So generally, the extension muscle of the tongue, we have the genioglossus, we have the hyoglossus, the styloglossus, and the chondroglossus. There is another muscle of the tongue which is going to be connected with the palate called the palatoglossus muscle, but it is going to be considered as a muscle of the palate and not a muscle of the tongue. So we continue with the next part. So here we now visualize the pharynx and the fosses of the pharynx. The fosses of the pharynx are just the grooves of the pharynx, as the name goes. So number 6 here is going to be called the palatoglossal arc. Number 7 here is going to be called the palatopharyngeal arc. The palatoglossal arc is going to be produced. So here we have the palate here, and we have the so this anatomy is going to be visualized both for the palate and the pharynx. So at this point here, connecting, so between these places is going to be called the palatoglossal arc. So inferior to that palatoglossal arc, we have a muscle here which is called the palatoglossal muscle. The same goes with the palatopharyngeal arc. The palatopharyngeal arc, inferior to the palatopharyngeal arc, we have a muscle underneath called the palatopharyngeal muscle. So now we have number 16 here. Number 16 here is going to be called the supratonsillar fossa. This one is going to be called the supratonsillar fossa. Number 9 is the palatine tonsils. So you need to know that what in between the palatoglossal arc and the palatopharyngeal arc, there is a tonsil here which is called the palatine tonsils. But the tonsil which lie just posterior and inferior to the tongue, this tonsil here was called the lingual tonsil. And there is another tonsil here which lies above here in the nasopharynx. In that one is going to be called the nasopharyngeal tonsil, or that tonsil is also going to be called the adenoid. So now the next thing to visualize is number 14. So number 14 here is going to be called the semilunar fold. So after visualizing it, this now is the microscopic view of the palatine tonsils. So on the microscopic view of the palatine tonsils, you have number 10. Number 10 here is going to be called the tonsillar pits. So you have some pits inside here, and in those tonsillar pits, you need to know that there are also some palatine glands. And then number 11 is going to be tonsillar crypts. So we have crypts and we have pits. Crypts are just like ridges, and then pits are like grooves. So now the next thing to visualize now is inside a little bit downward, which is inside the pharynx. So number 20, just number 20. So these are some of the muscles of the palate. So that you need to put in your mind. So the muscles of the palate, we have the levator veli palatini. So this number 20, you have levator veli palatini, you have tensor veli palatini. Now the tensor veli palatini is 20. Are you getting? So it connects the inferior aspect of the basal skull to the palatine, the palatine, to the palate. So you have the tensor veli palatini, which is number 20. Number 19 is the levator veli palatini. It's another muscles of the palate. The next one is 21. 21 now is called the ovule muscle. So this is the ovule muscle here. So these are the major muscles of this, and then the last muscles that I said initially when we were visualizing the tongue, the palatoglossus, is also considered among one of the muscles inside here. So the palatoglossus is here. This is the palatopharyngeus. So these can be considered as the intrinsic muscles of the palate, which are the tensor veli palatini, the levator veli palatini, and the ovule muscles. And then the extrinsic muscle can be considered as the palatoglossus and the palatopharyngeus muscle. And all that help now in the maintenance of the tongue, such that the tongue does not protrude posteriorly. Is it clear? And also it maintains the palate, such that the palate does not protrude posteriorly and occlude the nasal or the oral cavity. So these are the major muscles, and then you need to know that the major innervation of this muscle is going to be by the glossopharyngeal nerve, except one muscle which is being supplied by the vagus nerve. Now the next thing to visualize now is going to be the next part here, which is going to be the pharynx. So for the pharynx, so this is the pharyngeal cavity. So you need to know that this is the part now for the pharynx. So the pharynx, the first year, number 1 year, is going to be called the pharyngeal bursa. Number 2 is going to be called here the pharyngeal opening of the auditory tube. So you need to know that what they say, an auditory tube that connects the ear cavity to the nasal nasopharynx. You need to know that there are certain points in time where the air pressure in the environment is different from the air pressure inside your ear. Now just imagine that the air pressure in the environment is much more greater than the air pressure inside the ear. So there's going to be an inbulge of the tympanic membrane. That's may cause a rupture or a tear of the tympanic membrane. Now there is a use now of this auditory tube. This auditory tube helps now in the control between the air pressure of the external environment and that inside the ear canal, and that inside the middle ear, such that the pressure should be the same and then there is no injury to the tympanic membrane. That's why we have the auditory tube, which is being connected from the middle ear into the nasopharynx here. So this is its opening here. Number 5 here is going to be called the torus levatorius. So this is just the bulge of the levator. This is just the bulge of the levator palatini muscles, the levator veli palatini muscle. Now this here is a salpingopharyngeus muscle. Here this number 3 was the torus, number 4 here is the salpingopharyngeal fold. It's just for the salpingopharyngeus muscle inside here, which is number 28. Now we visualize the posterior aspect again. Here you have the epiglottis. Here you have the base of the tongue. Here you have already seen this at the lingual tonsils. Number 9 here is going to be called the velicule of the epiglottis. Number 10 here is going to be called the medial glossoepiglottic fold. So all this is the epiglottis, and this laterally is the lateral glossoepiglottic fold. So number 13 is going to be called the piriform recess, and number 14 is going to be called the plicae navilaryngeus. Now the next thing that you're going to visualize now is the muscle of the pharynx. Now you need to visualize that the muscle of the pharynx is generally divided into two. We have one which are the circular muscles, and number 2 we have the longitudinal muscles. Now the circular muscles is we have mainly 3 circular muscles. The first one is the superior constrictor muscles of the pharynx. We have the next one, the middle constrictor muscle of the pharynx, and then you have the third one, the inferior constrictor muscles of the pharynx. So number 22 mainly is the superior constrictor muscle of the pharynx, and the superior constrictor muscle of the pharynx is made up of 22, 23, 24, 25 and 26. So 23 is the pterygopharyngeal part of the superior constrictor, the pterygopharyngeal. So why is it called the pterygopharyngeal? It connects the pterygoid plate to the pharynx, to the lateral aspect of the pharynx. Here number 21 is a very important part, which is the pterygomandibular raphe. We need to know that what the pharynx is just like a space, a cavity. So you cannot just connect from a plate to the pharynx. Are you getting? So it connects to a major part, which is a raphe, and the raphe is an aggregation. As you can see here, you see what is called here. This is the pterygoid plate. As you can see, this is the inferior part of the greater ring of the lesser ring of the sphenoid bone. So this is the pterygoid plate here, and the pterygoid plate has the is at the inferior part of the pterygoid plate. We have the pterygomandibular raphe. So connecting between the pterygopharyngeus muscle is going to be connected to this pterygoid plate to the posterior part of the pharynx. Now the next part now is the number 24 here is the buccopharyngeal part of the superior constrictor muscle. So between the buccal part is still on the pterygoid plate, but it's here you have the buccal part more closer to the buccal cavity. And then number 25 is the myelopharyngeal part of the superior constrictor, and then number 26 is the glossopharyngeal. Glosso because it connects to the tongue, myelo because it connects to the myeloid process of the mandible. 24 here it's the buccal because it connects to the buccal cavity, and 23 is the pterygopharyngeal because it connects to the pterygomandibular raphe. Or the pterygoid plate. But you need to know that all these connect to the pterygomandibular raphe generally. Now the next thing to visualize is the middle constrictor muscles. The middle constrictor muscle is much more located here, and it consists of 30 and 31. 30 is the chondropharyngeal part. The chondropharyngeal part, as I've initially told you, I've said that the hyoid bone has a certain part close to on it which has cartilage. So that's that connection between the pharynx and that cartilage on the hyoid bone is going to be called the chondropharyngeal part of the middle constrictor. Now the next one is the hyopharyngeal part. Now this hyopharyngeal part now connects now with the major hyoid bone. Now the last one now is the inferior pterygoid muscle, which is 32, and it's consisting of 33 and 34. 33 is the thyropharyngeal. Thyropharyngeal, why? Because it connects the thyroid process to the pharynx, and 34 is a cricopharyngeal because it connects to the cricoid process and the pharynx. So these are the three major constrictor muscles, the circular muscles we have in the pharynx: superior, middle, and the inferior constrictor. Now, apart from these constrictors, we have now longitudinal muscles. Now, the longitudinal muscles consist of, there are three major muscles which are longitudinal muscles. Here, as you can see here, is a styloid process. As you can see here, this is a styloid process. Now, connecting the styloid process to the pharynx is going to be the stylopharyngeus muscle. So number 25 is going to be just called, number 27 is going to be called the stylopharyngeus muscle. So you can see connecting with the styloid process to the pharynx. So the stylopharyngeus muscle is there. The next one is the salpingopharyngeus. Salpingopharyngeus connects from the medial aspect of the OGG tube to the pharynx. So you can go far up to the medial aspect of the OGG tube to the pharynx, and it is number 28. I'm not sure you can visualize it on the diagram. Then the next one is 29. So we have already seen number 29. The last one, which is also another muscle of the pharynx, is the palatopharyngeus. So it's another muscle also of the pharynx. So apart from that, we're going to have 34 here, which is the buccopharyngeal fascia, and then we have all the likes. So we now continue with the next part. So from here we have visualized most of the part of the pharynx and the oral cavity. So from here, say thanks for kind attention, and don't forget to like and subscribe for oral videos. Thanks very much.